Good afternoon, everyone. My name is Nirav Shah, and I'm the director of Maine Center for Disease Control and Prevention. And I am joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are here to provide everyone an update on where we are with respect to COVID-19 in the state of Maine for today, Monday, November 23rd, 2020. And sadly, I begin today's update on a somber note. Maine CDC is aware of the death of an additional individual with COVID-19. He was a man in his 50s from Lincoln County, and his passing marks the 177th death of an individual with COVID-19 in Maine. I'd like to take a second to offer his family, his friends, and his entire community our deepest condolences during this time of grief. Right now in the state, there are a total of 10,544 cases of COVID-19, an increase of 185 individuals just since yesterday. Of those, 9,471 are confirmed and 1,073 are probable. As I mentioned a moment ago, there have been 177 deaths, and cumulatively 647 people have been hospitalized. Just in the past 30 days alone, 167 people have been hospitalized with COVID-19. And right now in the state, there are 103 people hospitalized, an increase of 9 hospitalizations since yesterday. Of those, 45 people are in the intensive care unit with COVID-19, 58 are in non-intensive care unit beds, and 11 individuals remain on ventilators. I'd like to take a moment to wish all of those hospitalized individuals, as well as all of those who are at home grappling with COVID-19, a speedy recovery. Overall in the state, over 8,000 people have recovered now, 8,006. And among our COVID-19 cases, 1,507 are among healthcare workers. Of cases reported to Maine CDC yesterday, 26% were from individuals in York County, and 23% were from individuals in Cumberland County. I'd like to take a second to talk about where we are with respect to outbreaks. As with the last few meetings, there are a number of new outbreak investigations that Maine CDC has opened just since the last time we spoke on Friday. This morning, we opened an outbreak investigation into the Newton Center, which is a nursing home that's adjacent to the Southern Maine Healthcare former Goodall Hospital. We've there detected 10 cases of COVID-19. That's the only outbreak investigation we've opened up until about 15 minutes ago today. Yesterday, however, Maine CDC opened a number of new investigations. One at the Barron Center involving 3 staff members, another at the Cintas Uniform Facility, where we're aware of 4 cases, and another at the Gray Birch Nursing Facility, where we are aware of 22 cases. And finally, another outbreak investigation opened yesterday at the Hudamaki Paper Facility, where we are aware of 8 cases. These come on top of several investigations we opened on Saturday. At Bankers Life and Casualty, 3 cases. At Doolin's Pub, 4 cases. At the First Baptist Church in Cherryfield in Washington County, 5 cases. At the Lewiston Fire Department, 7 cases. At Nate Holyoke Builders, 4 cases. At ND Paper, we've opened a new outbreak investigation after detecting 3 cases. At Noble High School, 3 cases. At Skowhegan Middle School, 4. At Somerset Rehab, 3 cases. And at Winterberry Heights, where we are aware of 10 cases. As always, Maine CDC works with each of these facilities, and an outbreak investigators focus on a number of different things, such as best practices around infection control, helping to arrange with testing, as well as, if it's a healthcare facility, making sure they have adequate and ample supplies of PPE. As I've mentioned, the number of outbreak investigations has expanded as we have opened more outbreaks in the past week alone, placing significant challenges on existing Maine CDC resources, something I'll talk about in just a moment. I'd like to now turn to where things stand with respect to testing. Right now, our 7-day test positivity rate stands at 2.70%, something of a relative plateau after seeing significant increases over the last 2 weeks. And our testing volume has achieved a new all-time high. Maine CDC on a 7-day moving average basis is now conducting approximately 731 PCR tests for every 100,000 people in Maine. One other note epidemiologically with respect to testing. In the last 7 days, Maine CDC has received an average of 265 positive test results every single day for the last 7 days on average. In the 7 days preceding that, the average was 218 per day. So just in the last 2 7-day periods, the average number of positive test results that are reported electronically to us, electronically or non-electronically, has gone from 218 to 265. But in the 7 days before that, the average was 165 results per day. To put all of that into perspective, so in the past few weeks, the number of new positive lab reports that are given to Maine CDC every day has risen by 60% just in the last few weeks alone. I say all that because I'd like to talk to you about some changes that Maine CDC is planning to make with respect to case investigation and contact tracing. Now, throughout this pandemic, we have endeavored to provide you honest, rapid, and accurate information about everything that's going on. To take a step back, I've got 2 mottos that I always keep in my mind anytime I'm speaking with the public. The first motto is to be first, to be right, and to be credible. And the second motto is that if someone asks me what time it is, I don't tell them how to build a clock. I tell folks what time it is. Those principles have meant that I'm often the first person to share difficult news. Indeed, much of the news that I share on a daily basis or 3 times a week basis is uniformly difficult. That's because in a pandemic, good news is a rarity. Typically, news is just varying degrees of bad. And that's because in a pandemic, there are no easy choices, just choices that are hard and harder. Our goal, though, has always been to make decisions that help the most number of people in the most number of ways. That is, after all, what public health is all about. And as I mentioned a moment ago, the number of new daily positive cases reported to Maine CDC has increased by 60% just in the past few weeks. And as I just today announced, there are at least 17 new outbreak investigations just over the weekend and into today. And that's on top of 20 new outbreak investigations that I announced on Friday alone. Now, Maine is not alone in this regard. Cases across the country have been skyrocketing. And in recognition of that, this morning, the United States Centers for Disease Control and Prevention released guidance for states to help us at the state level focus our case investigations and contact tracing resources on individuals who are at the highest risk of being affected by COVID. The CDC put forth 4 principles. Number 1, to maximize effectiveness based on time. Number 2, to protect household contacts. Number 3, prevent and respond to outbreaks. And number 4, to protect people who are at increased risk of severe illness. For example, individuals who may live or work in congregate living settings. These 4 principles that the US CDC put forth recognize the challenge that states like Maine are facing with greater numbers of cases and greater numbers of outbreaks. Accordingly, and pursuant to these principles from the US CDC, Maine CDC is preparing to make two changes to the way that we approach our investigation and contact tracing of COVID-19 cases. On the case investigation side, in general, we have endeavored to touch base with individuals as soon as we receive word of their positive lab result. And up until recently, on a periodic basis, to touch base with individuals who have tested positive until they have met the US CDC's criteria for recovery. Unfortunately, going forward, we have had to make a difficult decision, and I want you to hear about that difficult decision from me. Going forward, in light of the increasing rate of new cases, Maine CDC will continue to contact individuals after they have tested positive, and we will give them the guidance they need to stay safe, to give them the guidance they need to make sure they are isolating, that they have the tools that they need to isolate, that we are offering social services to make sure they can isolate safely, as well as to conduct an investigation into who they may have been exposed to and who they may have exposed others with COVID-19. However, that will be the one point of contact that Maine CDC has with individuals. We will not, as we have previously done, continue to touch base with individuals throughout the course of their illness. Doing so allows our case investigators to focus on individuals who are, for example, in the midst of an outbreak. There's a second change that we are planning to prepare to put into place, and that relates to contact tracing. We will soon be changing the way that we enroll individuals who are named as close contacts. As a reminder, if you've been in contact with someone who has been confirmed to have COVID-19, Maine CDC will touch base with that person, and they may say, yes, I happened to be in touch with Jane Smith a couple of days ago. And then our contact tracers will touch base with Jane Smith to let Jane know you were in touch with somebody, you were named as a close contact, you need to be in quarantine, and here's what you need to do in order to stay safe in quarantine. We will continue to do that vital contact tracing. However, previously, Maine CDC enrolled individuals as their names were given to us by the confirmed case. But the fact of the matter is, we shouldn't necessarily be enrolling folks based on when their name was given to us, but rather we should be enrolling folks based on when their last contact with someone with COVID-19 was. That way, we should be enrolling folks who have the most number of days left on their 14-day quarantine period, so that we can start working with them as early as possible in their quarantine period so that we can limit their exposure to others in the community and make sure they've got all the supports they need in order to stay safe. So going forward, Maine CDC is planning to enroll folks not based on when their name was given to us, but rather based on how many days they've got left in their quarantine period. Now, I want to make sure I'm telling folks everything else that's going on, because we're not just making these changes in isolation. We're simultaneously adding more individuals to our team of contact investigators and contact tracers. Just in the last 2 weeks, we've increased the size of our contact tracing and case investigation force by 40% just in the last 2 weeks. And we are continuing to add more individuals. We've added more training classes. We are hiring more folks, and our training classes and our hiring are full. But we are continuing to look for more individuals that we can bring onto the team. But sadly, in Maine and across the country, the virus is moving faster and spreading faster than the ability of states to train and deploy new public health investigators. We don't make these changes lightly. We make them recognizing the impact they may have, but we make them because we want to focus our efforts on the highest risk, most vulnerable individuals, those who are living in congregate settings, like nursing homes, those who are in the midst of an outbreak, like so many in the state right now. These changes may affect you, may affect many of you. Our team remains focused on providing public health guidance to the highest risk, most vulnerable members of the community, and making sure we are maximizing our resources to care for them. But these changes also underscore what each of us can do. As we go into a holiday week, please recognize that the choices that you and your family make this week can affect the trajectory of our state for many weeks to come. We at the Maine CDC will continue to combat the virus on multiple fronts, but each of us can today take steps that will make things harder for the virus, harder to spread, harder to harm, harder to hospitalize, and harder to take the lives of our loved ones here in Maine. The things that we do today will help us keep a lid on COVID next week and for the months to come, and will also allow us to celebrate with our families more fully, more robustly as we move through COVID. So with that, I'd like to turn things over to our colleagues in the media. And the first question for the afternoon goes to Patrick Whittle.
Thank you very much, Dr. Shah. I'm using a new audio system. Can you hear me okay?
Yep, loud and clear, 5 by 5, Patrick.
Okay, fantastic. Couple of things I wanted to touch base on. I'm wondering if either you or Commissioner Lambrew can speak to how much is left of the federal CARES Act dollars and what they might be used for. And also, is there any kind of an update available about what the state's immunization distribution plan might look like? Joe Lawler had a really good story about this over the weekend, and it sounds like details are coming more and more into focus, and I'm wondering if you would like to talk about that.
Sure. So on the Coronavirus Relief Fund, it's safe to say that the governor, Commissioner Figueroa from the Department of Administrative and Financial Services, all the other commissioners will spend every dollar that we've gotten from the federal government because our needs here in Maine are great. So we are currently in the process of seeing what might be left over and what could be spent by the end of December, because the federal law requires that the dollars not just be allocated, but spent by the end of the year. So here in the department, we've used that funding for all sorts of really important needs, like some of our testing capacity, some of our contract tracing services, providing infection control and prevention advice to our different long-term care settings. We have been grateful. We've been using that for advertising and educating people about our public health guidance. So we will continue to see how we can maximize that federal funding to help both prevent the direct effects of COVID-19 from hurting Maine people, but also helping those indirect effects. Last week, for example, Commissioner Johnson announced another round of this economic recovery grant program to try to help those businesses that have been harmed by the pandemic. We will continue to look at all available options to spend every one of those dollars.
And Patrick,
can you give me a sort of a, if you don't mind, could you give me a ballpark of how much will be spent by the time it's all said and done, Commissioner Lambrew?
We expect to spend every dollar of the $1.25 billion that we got.
Okay, great. Thank you very much for that number. I appreciate it. Dr. Shah, you were saying?
Yeah, Patrick, on the vaccine planning front, there have been a lot of discussions lately that I think really underscore the difference between the vaccine and vaccination. And here's just a few things that we've been working on in the last 36, 48 hours. Number one is making sure that our cold storage capacity, not just at the Maine CDC warehouse, but at other healthcare sites across the state, is ready to go to receive vaccine. I'm pleased to report that at least as to the Maine CDC warehouse, we've activated our cold storage capacity and our regular freezer capacity as well, so that when the vaccine starts coming in, we will be ready to have our warehouse be one of the staging areas. That's one thing. Another thing that we are working on right now is working really closely with health systems to help them identify who within their systems, healthcare workers, will be those who should be vaccinated, and how to get that done. It's all well and good to have the vaccine. It's all well and good to ship it to a hospital, but we've got to make sure we're working with them so they've got the requisite number of vaccinators at each of their sites to have high throughput. What we don't want to happen is for vaccine to be here, but then have there be bottlenecks in actually getting administered to healthcare workers. We had a very productive call with hospitals today to talk through that, to see what else we can do to help them. There are so many moving pieces right now, Patrick. I don't want to go into too many details. Is there one particular area that I can comment on or anything like that?
I think something that some folks might not be cognizant of is that this might be distributed in a way that a lot of folks haven't experienced in our lifetimes, where it might be given out in places like school parking lots and other places that are not indoors, and not necessarily where you think of when you think of going to get your shot. Are there more details you can provide about that?
Yeah. So, what we're going to be doing when we get to later phases of vaccination, phase 2 and phase 3, and for timeline clarity, that may not be until the spring or the summer of next year. The first doses that Maine receives will be really ones that will be focused on use within healthcare systems, not so much for the general public. But we are simultaneously planning for the general public. And there will be a mixture of the vaccination sites that everyone is used to, the doctor's office, the pharmacy, but we're also thinking about ways that we can use others in the community who are trusted and known to community members to stand up vaccination sites, like EMS clinicians, for example, and working with local fire departments, volunteer fire and rescue agencies across the state to have those be sites of vaccination as well. That's something that we're planning on and working with EMS clinicians and local fire and rescue officials. But again, that won't be something that we see in earnest until the late spring, early summer, most likely. I can't predict the timeline because that depends on so many variables of what happens with the vaccine trials.
Of course. Thank you very much.
Mm-hmm. You bet, Patrick. I'm going to turn next over to Steve Missler. It's been a minute, Steve.
It has. Thanks for taking the question. This is also about vaccine deployment. My understanding is that back in October, the federal government has asked the states to pre-position themselves for deployment. But there had been some pushback from some states that the federal government had not given states enough money to get them in a position for pre-positioning. My question is does the Maine CDC have what it thinks is adequate funding to execute its plan? And I'm also interested in the difference between how much money would be needed if it's the Moderna vaccine versus the Pfizer one, which is the one, of course, needs the supercooling.
Okay, so bottom line up front, Steve, additional funding is needed. What is at stake here, and the reason we need the funding is really to make sure we can vaccinate both with velocity as well as to make sure we can vaccinate equitably. So additional funding is needed. Commissioner Lambrew and I have both discussed at different times how the federal government, as well as Governor Mills, the federal government has a bigger role to play here. But Steve, you asked a particular question that I want to answer in a particular manner, which is the funding and its relationship to the pre-positioning. The pre-positioning is really making sure that the vaccine is ready to go when, for example, the US CDC finalizes its clinical recommendations. That is something we've been working with healthcare systems on for a number of weeks, actually over 2.5 months now. And we've identified 6 sites across the state that will be places for pre-positioning. That is not as functional upon the funding. The funding is really needed for things like Patrick was noting, planning for different locations of vaccines, planning for vaccinators, having an IT system so we know where the vaccine is at any particular time. That's where we really need the funding piece for.
Thank you for that. I just have a quick follow-up about, can you put a number on what you need based on, and if there may be 2 numbers, right? Because you have one for Pfizer, one for Moderna.
Yeah. Okay. Yep. So, and I didn't answer your latter question. The fiscal piece is affected by the Pfizer or Moderna, or perhaps in the not too distant future, a third and fourth vaccine as well. As many know, there was encouraging news this morning about a third vaccine. And yes, the fiscal element is affected by the storage, both in terms of the hub where the Pfizer vaccine may need to be stored, which requires cold chain, as well as the spokes to which it may be deployed to. Because outside of that ultra cold storage, the Pfizer vaccine can only survive for a certain number of hours. And thus there needs to be logistical support from things like dry ice or portable ultra cold storage units, all of which requires extra financing. In addition to that, the logistical planning around a vaccine that requires such unique handling is that much more difficult. Whereas the Moderna and the Pfizer vaccine, the Moderna and any other vaccines don't require that same unique logistical support, which means it can be deployed a little bit more easily, more deeply into other parts of the state and more flexibly. In terms of financing, the numbers turn almost entirely on those storage requirements. So right now, it's not as if we've got a number, a dollar amount that says we need X. It really does depend on, for example, if the Pfizer vaccine happens to be best for certain populations, that takes us down one fiscal path. If it's different for others, that takes us down another.
I will add that on the cost front, there is the financial support for the state of Maine and our public health infrastructure for vaccine distribution. But the federal government has made it clear that all types of insurance, private insurance, Medicaid, Medicare, will pay for that for providers and for consumers. So the COVID-19 vaccine, when it does come online, will be at no charge for free to Maine residents, as well as all residents of the United States.
Thanks.
Okay, I'm going to turn next to Kevin Miller. It's also been a minute.
Yeah, and thank you very much, Dr. Shah. So first, a question on vaccinations. As I'm sure you're aware, there was a public hearing today dealing with mandatory flu shots for healthcare workers. And guys, question, since this is obviously related to COVID and concerns about links between flu and COVID, can you talk about why the Maine CDC is supporting or proposing that they be mandatory for flu shot? And follow-up question, I understand that the rule would also make that possible for COVID-19 vaccinations, to make that mandatory as well. Is that in the plans?
Sure thing, Kevin. I'll start on both of those and then open it up. So as to the former, you're right. There was a public hearing today. That is part of the normal process of soliciting feedback from the public and the community to express their concerns or support for the rule that we proposed. That rule is one that would require healthcare workers to make sure that they have been vaccinated against influenza, a virus that can circulate within healthcare facilities. There are a number of rationales for that rule, one of which is that it's just good public health practice to have as many people vaccinated against the flu, because that helps keep community rates down. But it's also the case that every healthcare worker we can keep healthy and not affected by the flu is a healthcare worker that we can keep healthy and available to take care of COVID patients and other patients as we go into the winter months. So we also just wanted to make sure, and third, that we weren't setting up a system where healthcare workers could be accidentally introducing COVID into their facilities, accidentally giving patients the flu as they were caring for them for other things. Now, in terms of what this means for any potential COVID vaccine and healthcare workers, Kevin, it's too early to predict. I think right now our focus on COVID vaccine is on the logistics and on the rollout. I don't know where it really is too early to predict about any rulemaking that we may offer with respect to healthcare workers.
Okay, great. And just a clarifying question on, we're talking about the contact tracing changes that you made. So in the second announcement that you made, as far as when you're going to start counting the days, so can you give an example of how that would, just so I understand a little bit more about the impact. as it seems to me that this would potentially shorten the number of days that you guys are. No,
good,
okay.
good. No, it will not shorten the number of days. The number of days remains at 14. But let me give you just an example, and if the example doesn't make sense, let me know. Let's say let's say today, Maine CDC case investigators are talking to 2 new people who have just been diagnosed with COVID. And one of them says, hey, yeah, here's all the people I've been in touch with. And I was in touch with this person a week ago, this person 6 days ago, this person 5 days ago, so on and so forth. And another case investigator touches base with somebody and they get the same same type of numbers of contacts, different people, but okay, I was in touch with this person 7 days ago, 6 days ago, 5 days ago. That is happening every single minute as our case investigators are working with people. Previously, the way that we then entered those contacts into our contact tracing system was literally in the order in which they were generated to us. But really what makes more sense is we should touch base with the person who was the most recently exposed, because that's the person who's got the greatest number of days on their 14-day quarantine period. They've got the greatest number of days left. So if we touch base with that person first, we can eliminate the possibility or the number of days that they could be out spreading it. So we're touching base with people who've got the most number of days left on their 14, rather than just in the order in which people give us their names, which is the way that we had done it previously. We've got to make a choice about the way that we enroll people for contact tracing. And the choice that we're making today is to just start with folks who've got the most number of days left until they get to their 14. The 14 still stays the same though.
Okay, great. That makes more sense. Thank you so much.
Yeah, sorry for not explaining it more clearly, but thanks for asking.
Thank you.
Mm-hmm. I'm going to turn now over to Isha at the BDN.
Thank you, Dr. Shah. Can you hear me?
Mm-hmm. Go ahead.
Great, thanks. I have 2 questions today. The first one is about schools and testing. So the Mount Desert Island School District will soon start testing school employees weekly. And we just received word of this today. So do you know of any other school districts that are implementing similar testing strategies? And do you recommend that schools have one moving forward?
I'm not aware of others, Isha. That doesn't mean that there are not others out there. As everyone knows, there are quite a few school districts, and so there may be others. But I'm not aware of any. But again, that doesn't mean there aren't any others out there. And the decision decisions of this sort are ones where we honor local control with respect to how school administrative units are thinking about testing regimes. The US CDC does not have a firm recommendation on these things. It's not as if there is absolutely a one way to go. There are multiple different opportunities. And so we don't have a strong recommendation one way or the other. But we do recognize that different school districts will go in different directions. And that is, and I'm not aware of others, but we can try to see if we are aware of others.
Okay, just to follow up to that, do you gain any, as far as the public health agency goes, do you gain any epidemiological insight when schools test for, to kind of gauge the community transmission as opposed to just overall testing?
Yeah, any type of testing, so long as it's done in a systematic fashion, any type of testing gives us evidence or data of what's happening at the community level. School-based testing of, say, in this instance, teachers. I have not read their full plan, so I can't comment on it directly. But in general, any kind of systematic, deliberate testing regime of a group of people, and that's called cross-sectional testing. Any type of cross-sectional testing gives us information epidemiologically about what might be happening in the community.
Okay, thanks. My second question is about healthcare workers. Are you seeing trends in the types of healthcare workers that have been infected in situations in which they got sick?
We haven't seen any emerging or new trends in that regard, Isha. And one note I just wanted to make, when I mentioned the number of individuals who are healthcare workers who have tested positive for COVID, as of this morning, it's 1,507. That does not mean that they were infected on the job with COVID-19. It could just as well be they are a healthcare worker who happens to have acquired COVID in the community, and just like anybody else may have been exposed, say, at a small gathering. So I just wanted to be really clear. This is not healthcare workers who were exposed on the job. It is individuals who are designated, who are healthcare workers who have tested positive. We don't know anything about the direction or the place of transmission. It could be that they got it in the community. We take a look at those numbers because, of course, they impact how we think about staffing. And we haven't seen any new or significant trends in what types of healthcare workers or where they are being affected.
Thank you.
I'm going to turn things over next to Amy Brown.
Thank you, Dr. Shah. I have a question. Well, let me continue with the vaccination theme, and then I have a question that I think is probably more for Commissioner Lambrew. What percentage of the population needs to receive a vaccine in order for life to get back to normal? And if the people who don't feel comfortable getting vaccinated would wear masks and distance, would that provide enough protection if a certain percentage of the rest of the population did have the vaccine?
Sure thing, Amy. So there are models that help us understand what some of the thresholds that you are referencing get to. And for your former question, they turn on two things. How aggressively does the bacteria or virus spread? And how good is the vaccine? And the two are sort of in a sliding scale with one another. But based on the early data from the vaccines, which I want to note, have not been published or peer reviewed. So this is based just on what the manufacturers have reported to the media. So I'm waiting until I see the published data, but just based on those numbers, as well as how aggressively this virus spreads, epidemiologists have suggested that upwards of 70, maybe up to 80% of any population, statewide, nationwide, would need to be vaccinated for the virus to start decreasing in number. So, but there are two really important things there, Amy. The first is that doesn't happen overnight. It's not as if the minute we get to 78 or 80% that the numbers just disappear. Indeed, there are some diseases out there for which we've had vaccines for a long time, but they can still crop up from time to time, like measles. So having a vaccine will, unfortunately, and I give it to people straight, it will not result in a fairy tale ending of COVID-19. There may still continue to be cases. Now, with respect to your latter question around those who decline to be vaccinated, whether things like mask wearing and distancing will continue, will help perhaps bridge the gap. It's too early to say. We really need to know how efficacious the vaccine is. But I think the other thing I wanted to mention a moment ago, and in direct connection with this question, is even after a vaccine that is rolled out, there may still be a period where these everyday mitigation measures, like face coverings and social distancing, still need to be abided, because this herd immunity, as it's called, this threshold, isn't something that happens overnight.
Okay, great, thank you. And the other question that I think mostly is for Commissioner Lambrew. This is from a listener. She and her husband have to make regular trips to Boston for medical care for their son. Her husband wears a mask, waits in the car during the appointment, but they're trying to follow the governor's travel restriction requirements. So they'd been relying on testing. They can't do a 14-day quarantine every time they go for an appointment because they wouldn't be able to keep their jobs if they did. Now that testing is becoming more difficult, they're wondering if there's any kind of exemption, because the husband stays in the car, doesn't go inside during the appointment. He's basically in a vehicle that travels to Massachusetts and back. If there's some kind of exemption that he could get, otherwise, what their options might be, and this maybe Dr. Shah could weigh in on whether the home test kits might be available soon.
Sure. I'll just start by saying the whole goal of our policy for travelers to places where COVID-19 prevalence is higher than it is in Maine is to protect those individuals. Going into a healthcare setting, being around people where the prevalence is higher, puts that individual, that family at risk. That's why we had this policy to begin with. The advantage of people who are traveling on a fairly regular basis is that you can look around at gettestedcovid19.org. You can plug in a zip code and find the different testing sites and schedule those appointments. So we do know that there's been sort of a crunch around this holiday week with college students coming home and people who may be traveling for the holidays, despite some advice that it may not be the best idea. So we appreciate that there's been some crunch. We have actually reached out to all of our swab and sends and sought ways to support them in expanding their hours, expanding their capacity. Today, we opened our site up in Machias, for example. Tomorrow, 3 more of the Walgreens will be opening for their rapid antigen test for people who are symptomatic. So the short answer is we don't have a waiver or an exemption process for travelers to and from states where COVID prevalence is higher than Maine's, but we hope that our testing capacity here in Maine will be sufficient to support those critical types of visits.
Thank you.
I only have one thing to add, Amy, which is there are more and different types of testing mechanisms and tests that are being developed. And hopefully in the near future, some of the things that you referenced, like an at-home test, will be more readily available.
No, nothing right on the horizon, though. I saw that in Texas, they were actually distributing some of them, but then other articles say they probably won't be available until spring.
Well, the US FDA just granted emergency authorization for the first ever truly at-home test just a couple of days ago. And so I suspect that in the coming days, weeks, months, more such tests will be more available, which will certainly help ease the burden. We recognize the challenge that, for example, the family that you noted is facing, given their need to go to Massachusetts. It is definitely a challenge. Hopefully, as more tests become available that can be done in the home, that will help alleviate it.
Thank you.
I'm going to turn next to Stephen Porter.
Thank you, Dr. Shah and Commissioner Lambrew. I'd like to ask about the Newton Center in Sanford. Could you tell us more about the timeline of when those 10 cases were identified? Were they all recent? And does Maine CDC have information on how the virus entered that facility?
Sure, Stephen. They are, well, we just opened the outbreak investigation just in the recent couple of hours. So we are our field epidemiologists. So in any outbreak, we have a designated outbreak epidemiologist investigator. And so that individual probably, as we are speaking, is gathering information on those individuals, when they started showing symptoms, when they tested positive, things of that nature, and starts piecing together the puzzle. I can't comment at this time when or how the virus may have gotten found its way in. In general, we found that nursing home outbreaks are related to employees, but not in every situation. So until all the facts are in, Stephen, I as with any scientific endeavor, I want to make sure we've got all the facts first.
Understood. Thank you. I also have a question about the vaccination rollout plan, specifically with regard to providers. It's my understanding that without a signed vaccination program provider agreement, the CDC, the US CDC that is, will not ship the vaccine to a provider. So can you share where we are in that process and how it affects the timeline?
I certainly can. So you are correct. Per the US CDC guidance and rules, providers must have an agreement signed to be able to be part of the COVID vaccine process. It need not necessarily be healthcare provider by healthcare provider. It can be on a clinic by clinic or system by system, or on a clinic by clinic, site by site basis. We have had great cooperation. We'll get you the exact number of providers who have been enrolled as of this morning. The last time I got an update, it was it was 141 as of Saturday afternoon. It's probably gone up even since then. There's a few that we're still working with, but overall, we've had really great uptake and participation with the provider agreements. And again, just as a reminder, these are not provider by provider, they are site by site.
Great, thank you.
Mm-hmm. I'm going to turn next to Spencer Roberts at WABI.
Thank you, Dr. Shah. Two pretty quick questions. You mentioned there was you had a 40% increase in the past week in the number of contact tracers that are employed by the CDC, I believe. Do you have like a number of like what does that workforce actually look like? How many people are performing this work?
Sure. As of it's about 142 between case investigators and contact tracers.
Perfect. Thank you. And then just also briefly, we're now like regularly receiving messages from viewers asking about, a positive case in their hometown or rumors in their area. And oftentimes they're asking us why they haven't heard about it, either from the CDC or on the news. And maybe you could just reiterate for folks what constitutes an outbreak and kind of how that reporting gets done.
Sure. So the first thing, Spencer, I think that's really critical. And again, this is tough to say, but I want folks to hear it from me. There are cases everywhere in Maine, and cases will continue to increase everywhere, including in your community, including in your neighborhood. There are cases. And I say that recognizing the diversity of folks who are watching right now. There are cases in your neck of the woods. An outbreak is a little bit different. An outbreak has a more specific definition of 3 or more individuals who are confirmed to have COVID-19, who are connected in epidemiological ways, either because of connections in space, meaning they happen to work together or something of that nature, or connections in time. It can't be one person in June, one person in August, and one person in November. They've got to be in a situation that are connected in time so that we have good reason to believe that transmission may have occurred. The purpose of thus then opening an investigation is to actually determine whether transmission occurred, as well as to create a formal communication system so that the needs of folks who are affected by the outbreak can be put front and center. That's one reason some of the other changes I made earlier are so important. Folks who are in outbreak situations, whether it's at a long-term care facility or another health facility, we want to make sure we're taking care of their needs so we can limit the spread of the outbreak. So does that answer your question, Spencer?
Yes, thank you.
Okay. I'm going to turn next over to Bob Evans.
Good afternoon. The Vermont National Guard has begun making makeshift emergency hospitals, emergency healthcare locations in that state. Are we getting close to doing that here at the 2 cross center facilities in Portland and Bangor, like you mentioned early on in the pandemic?
So I'll answer to say that we are ready as needed to begin that type of deployment. We developed those plans in the spring. We, as Dr. Shah said recently, dusted them off. We're revising them, going over all the thresholds. When do we get close? When do we need to start doing that? We are not there now. We may be there soon, but we are going to be ready as needed.
The only thing I'll add, Bob, is as of right now, there are 102 staffed ICU beds. But that being said, there's also a significant number of folks in the ICU. So I completely echo and underscore what the commissioner mentioned. We're ready.
Okay. I have another question. It seems a lot of people are still planning to travel for Thanksgiving. Many out-of-state cars we're seeing coming into the state over the weekend for the holiday. Are you concerned about that? And do you have any advice for the people that are going to be traveling to Maine?
So I'm concerned. I'm concerned about folks who are traveling at any extent, whether they're coming to Maine or whether they're going from Maine somewhere else. I'm concerned about everyone's health, welfare, and safety over this week, as well as the coming weeks. At a big picture level, we have seen very concretely what can happen after gathering events like Thanksgiving, small household gathering events. This isn't a situation where we've got some epidemiologists at Maine CDC who ran some computer simulations to tell us what might happen. This is a situation where we can just look across the border to our Canadian friends to see exactly what happened after they celebrated their Thanksgiving on October 12th. They were already experiencing a surge. And then after their Thanksgiving celebration, that curve took a turn for even more vertical. The surge got even worse. That's what I'm worried about here. My tips are as follows. The first is, if you can, celebrate Thanksgiving with folks in your immediate household. That's what my family and I are going to do. If you are traveling, try to reduce your risk of harm. Wear a face covering inside. Try to celebrate Thanksgiving outside as much as possible. Keep the windows open. Make Thanksgiving a quick stop-by event for 10 or 15 minutes rather than a 6-hour dinner. Try where possible to limit your interaction, because the choices that folks make this week will affect the state of Maine for weeks to come. Where possible, stay inside with your immediate family. It's what I think of as a call to inaction. Try to stay inside with your close family as much as possible.
Thank you.
And I'm going to close out the afternoon with Steve Batari at WMTW.
Dr. Shah, good afternoon. Good to speak with you. Wanted to ask you about kind of the space before we get to the vaccination. Obviously, there's been a lot of talk about it, but you know, at this point, we have more than 10,000 who have now tested positive in our state, and we have months to go before the general population sees a vaccine. And I ask this because the British Medical Journal had a study this week published talking about how young, low-risk patients 4 months later are still dealing with symptoms of coronavirus. Most commonly reported symptoms were fatigue, muscle ache, shortness of breath, headache, gastrointestinal issues, and 2/3 showed evidence of impairment in one or more organ system. So I guess the question is, one, broadly speaking, is this consistent with what we're seeing here in Maine? And the second question is, moving forward from a public health perspective, how does Maine CDC help those with so-called long COVID?
Yep. Steve, I'm glad you raised that. That paper in the British Medical Journal was one of the better ones to date to characterize the long-term experience that some folks have with COVID-19. And as you saw in that paper, or for everyone's awareness rather, the paper found that a sizable fraction of people, up to 20% in some of the pockets in the UK and elsewhere, had long-term symptoms that they continued to grapple with COVID-19. That is largely consistent with what we've heard from clinicians across the state as well. Patients who may have been affected several months ago who are still not back up to 100%. You know, for me, Steve, this really just underscores how difficult and how challenging COVID-19 is, as well as how difficult it is to convey this, right? I mean, I talk about individual numbers. Sadly, I talk about fatalities, hospitalizations, but that doesn't even begin to touch upon the long-term experience that so many with COVID sadly have. As a public health and as a scientific community, we're starting to do better at characterizing that. But it's yet another figure that demonstrates how difficult COVID-19 can be and how we don't even have a number and a language for how to characterize it so we can talk about that. I sadly fear that as we go through COVID, we're going to discover more and greater numbers of side effects, as well as long-term, what are called sequelae, long-term clinical consequences that can come with COVID-19. I've said it before today, and I'm going to say it again. This just is yet another reason as we go into a holiday week to take steps to take care of yourself and your family. If you don't think you're at risk for COVID-19, you are. If you don't think your family is at risk for COVID-19, they are. If you don't think that COVID is in your neighborhood, it is. And if you don't think that people in your community, loved ones, could be potentially affected, hospitalized, and even sadly lose their lives to COVID-19, the answer is that they can. So as we go into this critical week of dealing with COVID-19, a week that could determine whether our trajectory is one that levels off or continues to climb at an ever-increasing rate, I am asking everyone to do their part and to do the right thing. So that rounds out our questions for the afternoon. I'd again like to take a second to thank everybody for tuning in. We had difficult news to share today, but I wanted to make sure that everyone heard it directly from me and Commissioner Lambrew. These are difficult times. We will continue to endeavor to fight the virus in every single way we can, but we are also asking for your help. Please do the right thing this week. With that, thank you all for your time. As always, please be kind, take care of one another, and we'll talk again on Wednesday.